Hi, I'm Dr. Goldkamp, and welcome back to another episode of the Keto Naturopath. Today, I'm going to go a little further with the interview I did with Dr. Alan Gaby, probably about a month and a half ago now. We still have a few more sections to go. As I mentioned before, in talking to Dr. Gaby, it is so concentrated, you have to take it one piece at a time. And so the piece we're going to talk about today is about iron. You know, you go, well, gee, gosh, that's one of the standard parts of your labs. It is standard, and yet it's kind of undiscovered. I'm rediscovering it myself in a way after having run so many years of doing iron and who's coming up deficient in it and how it's useful and excess in it. So I would like to take you into both the interview I have with Dr. Gaby about iron, which will be very brief. Then we're going to go into his book, and then we're going to go into my labs to give you some example of what this is about. So as you know, this book I have such appreciation for, and I have appreciation for Dr. Gaby as well. I was lucky enough to be at a medical school when he was teaching there. And so it's really out of a debt of gratitude. I have no financial connection to this book at all, but it represents a time in which we all had in our various homes absolute bedrock references. If you wanted to know how to spell a word, you went and you looked it up. And you had to figure out how to spell it in order to look it up. I understand that. We had a generation of people who had encyclopedias at home, or they went to the library to look it up in an encyclopedia, or 5 encyclopedias that were at the library. That was the instinct of what you needed to do. So what did you do about medicine? What did you do about nutrition? What did you do about how to understand nutrition? This is that reference. This is right up there with the dictionary, with the encyclopedia. People don't have dictionaries anymore. They just figure it out online. They don't have encyclopedias anymore. They do Wikipedia or something even worse. So I hope you consider not only purchasing this book, but using this. You get some free chapters. We'll possibly get into that later again, as I did before. But we're going to talk about iron today. And I hoped that you will see iron like you haven't seen before. You'll see some examples of people who thought they had it all under control and they just wanted to go keto and lose weight and change their whole life, and how misguided that was. Okay. You know, you talk about iron, not a lot, but it comes talked about your dad with Dr. Perlmutter's interview. And I think it is so underutilized both as a test. It's almost like the boring part of labs. You obviously do iron, but you do ferritin and saturation and TIBC and so on. Pretty standard. Do you value one portion of that over the other? I mean, do you sort of say it's, you know, if you have normal iron, low ferritin, do you sort of say, well, you know, we're kind of functioning, but the boat's getting pretty empty here?
Well, I described how to evaluate lab tests, iron tests in detail in the textbook in my chapter on iron, and I reserve the right at my age to forget anything that I've written down. However, what I will tell you is that none of the tests are always reliable, because ferritin, for example, rises in response to inflammation. Percent transferrin saturation is affected by other factors, which I don't remember, but it's well known. So what I usually do is, if I'm really worried about iron deficiency, I'll measure them both. And I'll take inflammation into account. I'll take whatever other factors I read in my book that you have to look at. Yeah. But yeah, in general, I like to do them both because you can get a better idea of that. The best test is a bone marrow biopsy, and nobody's going to be doing that. That's the most reliable. And you try to find lab tests that correlate best.
Yep. Okay, now I want to take you into his book to discover some things that you didn't know about iron or you thought you did. And this is both to encourage you to get this as a reference, as I said, but to explore the idea that, you know, we are in an era, the way I look at it, a marketing era in which there is so much fake information around you. So I call this the Keto Naturopath because I'm a big believer in the ketogenic diet and low carb, moderate fat, and high protein. That's kind of the essence of Dr. Goldkamp and my wife as well. So that's why it's called this way. But there's so many people that just go, oh, I'm keto and it's changed my life. Well, where's the nutrition? They could have stupid fats, they could have unnutritious food and still be in ketosis. So the idea of nutrition is almost like, oh, that makes keto too complicated. Well, without nutrition, without some sort of awareness, without some sort of reference of what is an appropriate diet, people drive themselves into ill health unnecessarily, completely unnecessarily. So let's take a look into Dr. Gaby's book, and this is the chapter on iron. I copied it to put it in this way, and I want to read a few things to you that are maybe is so basic. One is that iron is not just about hemoglobin and taking oxygen and, in your lungs and taking it to your big toe kind of thing. It also has to do with what they call electron train transport, right down to your mitochondria, a whole different role. It's that vital. So when people that are iron deficient or have too much iron, everything gets messed up. Everything gets messed up. They can't sleep, their energy, their moods, their emotions, etc. So that's why it's really important. Let's look at some things. There's a difference between people. People come to me and they go, do I really have to have animal protein for iron? No, you don't, but it's like, it's 100% easier. So why is that? And I'm just going to jump what they call heme iron. Iron that's from hemoglobin is found in meat, poultry, and fish, is well absorbed, whereas the absorption of non-heme, plant-based, from iron, most other foods, and in supplements, is much lower absorbed. Depending on a person's iron stores of heme and iron, the absorption of non-heme iron is increased by the presence of meat. So in other words, having veggies with meat makes it even more so. Okay, so we'll say, in contrast, most studies have found that the absorption of non-heme iron is inhibited by a number of foods, including coffee, tea, soy products. Let's do that again. Is inhibited by a number of foods, coffee, tea, and soy products. So this is from real world practice, is that I'll have people come in, usually it's women, sometimes it's men. So let's say 90% women come in that are anemic. They're not just all premenopausal, they're postmenopausal actually for the most part. And so they're anemic, and we'll get to labs to see what that's like. Why is that? They're big coffee drinkers, and the cycle starts that they're usually a plant-based person, so they're kind of borderline anyway, but they want their energy up. They want more energy. So what do they have? More coffee and more tea, and that actually depletes, it blocks the iron that they're getting from being absorbed. So it makes that situation even worse. So they're actually more tired. So they drink more coffee and they get more tired. Maybe not that initial little caffeinated spurt, but they get more tired throughout the day. And as their iron goes down, their sleep becomes disturbed. Now they are sleeping worse and worse. They don't wake up rested. So why is that? It's because you have less and less iron. Now your heart has to pick up its blood pressure. It has to start zipping the red blood cells around so it can do its job faster. It gets fewer oxygen carrying capacity, so it has to speed it up. So your heart now starts to beat faster. You get, if not hypertension, high heart rate. So that starts affecting your sleep. So this cycle goes on and on. So what do you do? First of all, you get in the labs and you go, this is the first thing we need to treat. You counsel them on diet, and you'll help them supplement to get them to the place of having a healthy range of iron, and we'll see how to measure that. And then finally their sleep gets better, their energy gets better, and you counsel them on, did you know that coffee is part of the contributing factor of you being partially anemic or frankly anemic? That's assuming they didn't come from a bleed or something. Okay, so coffee, tea, soy products block non-heme iron for the most part. Okay, then, what else can we say? This is really interesting. Also, wheat bran, wheat gluten, or oat products, nuts, casein, egg white, whey protein, etc., etc. It goes on and on. These are things that can potentially block iron. You go, well, that's quite a list. Well, an awareness is really important. It says fermented soy products inhibit iron absorption significantly. How often have you heard, oh, you need to have fermented products, especially tempeh, which is fermented soy products, blocks iron? Whoa, didn't know that one, did you? So it takes a little bit of an awareness of what you're doing, because we're now living in the era, and I so believe this, and I get so irked by it, that it's, no, I want this one thing. Just tell me the one thing that'll change my life. To lose the fat, that give me more energy, that give me the brain buzz so I can work all day. It's really unrealistic. It's a tad superficial, certainly. And I'm just asking you to go deeper. So I'm going to skip down. What else? We can look into Iron may be useful for preventing or treating the following conditions: alopecia, when you have heard that, athletic performance, of course, attention deficit hyperactivity disorder, when did you hear that? Perhaps dementia, perhaps infertility, fatigue, of course, pruritus, restless leg syndrome, urticaria, which is kind of a hives, rashes. Okay, then, talk about deficiency. What is deficiency like? I'm not going to go into all that. Causes of deficiency, it really comes down to it's either assuming there's not a genetic cause to all this, it's either you're bleeding, right? So you're losing blood, pretty straightforward. You're not going to have enough iron carrying to capacity, or you're just losing it. You're having a net deficiency. The water's leaking from the dam or whatever, if you want to look at it that way. Or for whatever reason, you're not producing your red blood cells that carries the iron, hemoglobin, and or you're certainly not eating what you need to be eating, and you're having a very unnutritious diet. That's pretty much the causes of it. And they give you, reference reagents for your age. And what's really interesting is non-breastfed children, and I'm paraphrasing, are more likely to be iron deficient than breastfed children. And they have various studies that he goes over, which are great to listen to, that you've never heard before, right? Okay. And we talk about adverse effects of taking too much iron. Taking too much iron, you crank up your inflammation. Cranking up your inflammation is like a fire in your body, and it can go on to various organs. But what you feel at first, again, is just like the deficiency. It's going to affect your nerves. It's going to affect your ability to counter stress. It's going to affect your sleep. Here's something really interesting. It's like, what are the drug interactions? And he has this as part of everything he does. So we have acid suppressive therapies. So they say treatment with drugs that suppress gastric acid may decrease the absorption of iron. ACE inhibitors, angiotensin, that is, people use for blood pressure. I want to jump to this one because we're going to see this as one of the examples that we use. This is a kind of antibiotic. Fluoroquinolone antibiotics, and they have Cipro and so on and so forth. That is a category of antibiotics that makes it so you can't absorb iron. So you become iron deficient secondary, caused by the antibiotics you've been taking. Now, the problem is sometimes people have to be on antibiotics for a very long time, and nobody checks their iron levels, and so they feel worse and worse and worse. And then they put them on steroids because maybe that's going to change this thing. So the example we're going to see today is one of the three, is a person who was on fairly long-term antibiotics, then got what they call C. difficile, which is basically a depleted microbiome. So her ability to collect nutrients from the food she was eating, so it wasn't so much about a diet, was that she could not absorb, was caused by this. And she has a number of other deficiencies, no doubt. But we'll just talk about iron today and penicillin. And then we have other nutrients that actually block these if taken at the same time. Food sources of good sources of iron, pretty straightforward, right? Heme iron is the best. If you really are a vegetarian, you got to work really hard to make sure you get enough iron because it's not all absorbable. Yes, you can say, what about spinach or kale or dark green leafy vegetables, which used to be the answer in med school? They're not that absorbable. I'm not saying they're bad examples, but they're not that absorbable. If you have a steak versus kale versus spinach, there's no comparison. 80% absorbable versus maybe 5. And that's not counting the other part of this chapter are phytates. Those are things that come in plants that bind with the iron so it doesn't get absorbed. So as much as we talk about good source of iron, see, that's another bit of the bogus sort of misrepresentation. Good source of iron from dark green leafy vegetables. Well, guess what else comes from dark green leafy vegetables, primarily spinach and kale, and thinking off the top of my head, is phytates. And the phytates and oxalates bind the iron and keep it from being absorbed. So there you go. What else can I mention here? It's just really important. And certain things you need to have ideally with the same thing, which if you have whole food sources of food, you don't have to worry about this combination. When you get stuck on taking your vitamins, well, now the knowledge a little bit becomes your responsibility of making sure you have a balance here. Okay, so now let's get to the labs. Okay, right now we're looking at 3 different people. Their labs. We're just going to go over iron and what they call their CBC a little bit. Everything has to do with iron and the problems that this is starting to cause for different people. So what we have are 2 women and one man. We have a postmenopausal woman in her mid-50s. We have another postmenopausal woman in her mid-70s, and then we have a man about 50. And so their complaints were, 2 of them were about losing weight, and one was couldn't gain weight. So let's take a look. When we do a CBC, complete blood chemistry, it's not that complete, but it's just an old part of labs, is we tend to look at platelets, the size of platelets, hematocrit, how much blood you actually have. They're all basic sort of parameters, but it's very helpful, and it does overlap with the iron. So we have platelets across the top. How I use platelets are, is there an inflammatory process going on? If they have a lot of platelets, usually there's an inflammation going on. And I'm just going to point out what's necessary to know. Here's your hematocrit. That's the volume of blood you have. And ballpark 45 is the number we're looking at. It's a percentage. Um, and that's red blood cells, white blood cells, serum, the whole 9 yards, the whole bathwater of your system, so to say. And so you need about 45. So what do we have here? We have 2 women are they're below the range. So they're very deficient just in the volume of blood. They're hypo serum and not just iron. We have to ask the question, why are they so low? What are they low in? Whereas the man, 47, that's kind of an average number. It's good, perhaps maybe even a little bit high. So now we go a little further. We look into hemoglobin. So what we find is the 2 women almost have the exact same number, 11.5. Forget about the numbers, but just the red is deficient and or excessive, and I'll point it out. And so the man has pretty normal numbers all around. You know, nothing egregious at all. The 2 women are deficient. And so the question, why are they deficient? You can't just say, well, they're women and they're older. That doesn't work. It's like you can say collectively, the postmenopausal women are more deficient than their same aged match men. So that is something to look forward to, but there's plenty of men that are deficient as well. And we'll get to why the man, is excessive. So we find that the 2 women have low hemoglobin. So they have a decreased ability to carry oxygen. So they should be just kind of generally tired. That would be the question. And then you have things like this mean corpuscular hemoglobin. Basically, it's the average of your iron throughout all your red blood cells. Is it about the same, or is it narrow? And that's also lower in one than the other. And then we get down to red blood cell count. How many red blood cells? So some people, let's say, take multiple myeloma, which is the disease my brother died of, is that what happened is the marrow can't produce the red blood cells. It's blocked. So the number of red blood cells decreases, not so much the iron per red blood cell. So they're not necessarily iron deficient on a per red blood cell basis. People like that, they have too few red blood cells. So they also have a decreased ability to carry oxygen. So they get tired. That's usually the first symptom of multiple myeloma. I'm tired. I was once a strong guy. Why am I tired? And you'll find out it's a bone disease for the most part. Okay, so they both have a reduced number of red blood cells by a little bit. They're at the lower, just under that. So now let's look at iron. Well, the younger woman has far less iron than the older woman, but they're both, and I have 2 numbers here because I've taken this person's twice, and they are borderline okay versus low. The younger woman, post mid-50s, is clearly low. So the range is 60 to 170, 26, that's low. That is gaspingly low, tired. Ferritin, which is your iron supplies, you would figure if your serum level, the stuff that's being shipped around, right, from your lung to your big toe to your ear to make sure everything has enough oxygen, that If that's low, I call them buses. If the buses are so few, the backup system, which is your storage, ferritin, is also going to be low. Absolutely, in this case, she's scary low. And then we have other fancy things, percent saturation, and we'll get into that. It's not necessary. If you don't have enough iron, you have a lot of capacity. You have empty buses, so you have a lot of capacity to have more iron. Anyway, so let's look at inflammation. You'll find this person who is very deficient in iron has pretty high inflammation. We call that CRP. Look at the guy over here, I forgot to say that why he was so high in iron? He was told by his MD, his doctor, that because he has a genetic mutation, MTHFR, we looked into it and he did, but it wasn't homozygous, it wasn't on both, and it wasn't such a big deal. He should take this particular supplement and it had iron in it. Men don't take iron. Men don't take iron because they don't bleed. They don't have unless they did bleed. So he got progressively higher and higher and higher. And to the point that, what was going on? And he thought it was his genetic disorder. It wasn't his genetic disorder, which he hardly had. It was the fact he was taking iron. So it wasn't until we went through all the supplements we were looking at saying, what the heck is this? Why are you this way? So that's the situation of somebody taking a supplement to thinking it's going to make them feel better, and they went quickly off to a bad outcome. The woman who is deficient, her story is that she has had a bad gut. She was on antibiotics for a while, as I'd mentioned before, and her absorption for various minerals was decreased by a lot. Iron is pretty easy to measure in this particular case, and so it was caused by the long-term antibiotics that she was on that basically ruined her microbiome to the point that she had what they call C. diff, which is a diagnosis you get when you're on a lot of antibiotics for a long period of time. It ruins your microbiome. And consequently, you get a lot of inflammation that you're just malnourished because of the antibiotics. All right, what else do I want to point out? We looked at things like hemoglobin. They're all about the same. They're, I would say, high normal. There's nothing bad I can say. Their insulin is high normal. The older woman has more of a perfect. And then we looked at glucagon. Glucagon is the pancreas signaling to your liver to make sugar. Give me some glucose. Make me some glucose. Gluconeogenesis is the word. And often when people like this middle woman in her mid-70s, when you get so iron deficient, your body is trying to just, what energy do we have? Let's make some glucose, and at least we'll feel better there. So she had one of the highest readings of glucagon that I've ever seen, whereas the man, who is the highest iron that I had ever seen, had the lowest glucagon. Okay, so he said, well, we have a pattern here. Well, now we go to this woman who has a totally depleted microbiome from all those antibiotics. Her pancreas is shot. She's hypoglycemic, so she's can't really even make her own glucose. She has a good fasting glucose, but she has low iron, so she's pretty much tired all the time. So now we have to gradually build her up. But these are all people that thought, I'll do keto and life is going to change. And I'm going to get better sleep, I'll lose weight, my brain, I've heard about brain health. All these things are true, but they aren't going to compensate for poor nutrition, was the point here. So I'm going to leave it at that by saying, I so love talking to Dr. Gaby, and you'll remember what he said is that no one test is 100% accurate. No one test is 100% accurate. You have to look at the context. These are little clues. You don't go, I have 26 for iron, so I'm low. Well, you probably are, but let's look what else is going on. What's the bigger story? Microbiome? Is it diet? The woman who is low iron, she really was diet induced. As we get older, we tend to eat less protein, so it's less animal protein. We have less of a appetite, and so it works against us. We have to be aware of that and make sure we have those foods or supplement to make up for the difference. Okay, till next time. Hope you got something out of it. Shot in the arm, eh?